covered here, and also we discuss most expected questions for which are important for the university exams. So in Auricle, we provide live classes for the elevated learning of the students where knowledge meet interaction. Then also recorded sessions are there, recorded sessions so that the student will have the access anytime, anywhere of all the subjects. Notes are being provided which are CBM, which are having CBME based question answers, MCQ and full zone for self-assessments. Then MCQs are there from beginner level to expert level, which contain standard multiple choice questions. We provide subscription plans starting from basic to standard to mentorship plan. Basic plan is of 3 months, standard plan is of 6 months, and mentorship plan is of 12 months. In mentorship plan, we provide pre-recorded classes, live class, live doubt clarification, one-to-one personalized guidance, notes, quick revision examination module. And this plan costs around 50,000. Also, for instant 20% discount, you can use my code, that is Dr. Aanchal 20. So let's start with today's class. So first we're going to discuss and we're going to know about the very important topic, that is COPD. So COPD means coronary obstructive pulmonary disease. Okay. So this is a disease, or we can call that this is a chronic inflammation inside lungs. Okay, that's why it is known as chronic obstructive pulmonary disease. This is the disease of lung where inflammation will be there, and inflammation is the region of the obstruction. Okay, so this disease will cause obstruction to the airflow. Okay, so here there will be obstruction to the air flow. Okay, now various kind of symptoms are there. Those symptoms includes like the person will having breathing difficulty, because obviously if there is any kind of obstruction in the airflow, the breathing difficulty is very common symptom. Then cough will be there, mucus, or the person will have the sputum, then production of wheezing will be there, and it is typically caused by long-term exposure of any kind of irritating gases or particular matter of any matter that maybe the person is being allergic. So if the person is having long exposure of any irritating gas or particular matter, most often the cigarette smoking. Okay, so people with CPOD are at risk of developing heart disease, lung cancer, and also these kind of people can have variety of disorders. Right now, the CPOD often don't appear until significant lung damage has occurred, and they usually worsen over time, particularly if smoking exposes contents. Okay, so various signs and symptoms are there that we're going to discuss. So signs and symptoms includes, as we have discussed, the short of breath will be there, especially during physical activities. The person will be having the wheezing, then chest tightness, then frequent respiratory infection, lack of energy, then swelling in ankles, feet, or in legs. Okay, so these are the very common signs and symptoms. Maybe if the person is having this disease CPOD, so the person will be associated of these kind of signs and symptoms. Okay, now what is the cause of this CPOD? So the main cause of CPOD in right now is usually tobacco smoking in the surrounding. Okay, and CPOD often occurs in people frequently exposed to any kind of fumes from burning fuel for cooking, heating in poorly ventilated homes. Okay, so these kind of causes are there. And what are the causes of airway obstruction? So many causes are there, like emphysema. So what is emphysema? Like this is a lung disease that is which causes the destruction of the fragile walls and elastic fibers of the alveoli, right? And another causes of airway obstruction could be like chronic bronchitis, in which bronchial tube become very inflamed, okay, and they become narrow. right? So these are the causes, sign and symptoms of this disease, that is CPOD, right? Then next we have this obstructive sleep apnea. Okay, so before learning the obstructive sleep apnea, we should know what is obstructive apnea. Okay, so obstructive apnea occurs because of the obstruction in the respiratory tract. Whenever any kind of obstructions are there in the respiratory tract, so respiratory tract obstruction is mainly due to excess growth tissue like tonsils and adenoids. So common obstructive apnea is the sleep apnea. Okay, now what is sleep apnea? This sleep apnea is basically the temporary stoppage of breathing. Okay, so this is temporary stoppage of breathing that occurs repeatedly during sleep. Okay, and this is also known as sleep disordered breathing. Okay, and it is very commonly affect over um, uh, those people it will affect who are having the high weight. Okay, now what are the main causes of this sleep apnea? So the main causes is the obstruction of upper respiratory tract. And why there will be obstruction? Because of the excessive tissue growth in the airway, like large tonsils and large tongue, right? Now what is the characteristic feature of sleep apnea? So if we talk about the characteristic features of sleep apnea, so it will be loud snoring, and snoring without sleep apnea is known as simple or primary snoring. Okay, but snoring with sleep is serious and it may become life-threatening also. Okay, so this is all about the obstructive sleep apnea. So it occurs during sleep, your muscles relax and cause complete or partial collapse of the respiratory air. Okay, fine. Now, next we have the very important topic, that is hypoxia. Okay, so hypoxia is the very important topic for the university exams also. So what is hypoxia? Hypoxia is defined as the reduced availability of oxygen, or whenever there is deficiency of O2. Okay, so reduced availability of oxygen to tissue, and there is also another term that is known as anoxia. Anoxia means absence of oxygen, totally absence. Okay, so in older days the anoxia term was in use, but right now we use hypoxia, because since there is no possibility of total absence of oxygen in living condition, so that term has now abandoned. Okay, so right now we use the term hypoxia, means deficiency of oxygen. Now, what are the causes of hypoxia? So, various causes are there. Some of them we're going to discuss. Whenever there is reduced oxygen tension in arterial blood. Okay, reduce. Then oxygen carrying capacity of blood get decreased whenever velocity of blood flow also get decreased, and whenever there is less utilization of O2 by cells, right? So these are the causes, and based upon these causes, we have classified the hypoxia as hypoxic hypoxia, as anemic hypoxia, as stagnant hypoxia, and as histotoxic. Okay. Now we're going to learn about the classification of hypoxia. So we're going to learn the classification on the basis of features. Okay. So features we have PO2 in arterial blood, then O2 carrying capacity of blood, then velocity of blood flow, then utilization of O2 by tissue, and the last we have the efficacy of O2 therapy. Okay. So one by one, we're going to discuss these features in hypoxic hypoxia, in anemic hypoxia, then stagnant, and in histotoxic. Okay. So as we have already discussed that these four types of hypoxia has been classified on the basis of cause, and cause already we have discussed. Low oxygen tension mean hypoxic hypoxia. Low oxygen carrying capacity of blood is anemic hypoxia. Low velocity of blood flow is stagnant hypoxia, and less utilization of O2 by cells is histotoxic hypoxia, right? So as we have discussed, PO2 in arterial blood will be less in only hypoxic, otherwise it will remain normal in all other, right? Then O2 carrying capacity will be only less in anemic, otherwise it will remain normal in all of them. Then velocity of blood flow will be reduced in stagnant only, otherwise it will remain normal in all other. And finally, the utilization of O2 by tissue will be reduced in histotoxic only, otherwise it will remain normal. Then, if we talk about the efficacy of O2 therapy, means in which case the efficacy will be more, means it in which case the O2 therapy will be more efficient. Okay, so obviously in case of hypoxic, means whenever there is low pressure of PO2, the efficacy will be 100%, and in other factors it will be reduced, but in histotoxic it will be not useful at all. Okay, it will be around 75% in anemic and less than 50% in stagnant, right? Fine. Now, another thing is that what is the effect of hypoventilation? Okay, means whenever there is excessive hyperventilation is there, or there is any kind of decrease partial pressure is there, whenever we go to high altitude, that at that time what happened exactly? So hyperventilation means they will be condition like hypoxia. Hypoxia and hypercapnia. Hypercapnia means there will be excessive CO2 will arise. Okay, so obviously there will be increase in rate of respiration, right? It will lead to difficulty in breathing, means dyspnea, and dyspnea will cause lethargy. It will lead to coma, and coma will lead to death. Okay, so this is the severe causes of hyperventilation. Okay, fine. Next, we have the oxygen therapy. So, best treatment for this condition, that is hypoxia, is the oxygen therapy. Oxygen therapy means treating the affected person with oxygen and pure oxygen or oxygen combined with another gas is administered. Okay, so this is the treatment for hypoxia. And in which type of hypoxia it will be more efficient? Any answers? Anyone is there to answer? Yes, it will be in oxygen therapy. Okay, so here oxygen therapy is carried out by two methods. So two methods are there. What are those two methods? First, by placing patient's head in a tent, and the tent containing oxygen. right? Another method is by allowing the patient to breathe oxygen either from a mask or from the intranasal tube. Fine. Now, depending upon the situation, oxygen therapy can be given either under normal atmospheric pressure or under high pressure. Under high pressure means hyperbaric oxygen. Okay. Now we're going to know that what is hyperbaric oxygen therapy. Okay. So this hyperbaric oxygen therapy entails breathing pure oxygen in a room enclosure with the high pressure, and this has a chamber has 3 times the normal air pressure so that the lungs take more amount of oxygen. Okay, so there will be more and more inhaling of oxygen, and this oxygen rich blood circulating in the body can help fight bacterial infection or procedure growth factors and stem cells to accelerate healing, right? So this process helps patient with serious infection, bubbles of air in blood vessels, and wounds that won't heal as a result of diabetes or radiation injury. So in other words, if we know that what is this hyperbaric oxygen therapy, so this is the pure oxygen with high atmospheric pressure of 2 or more than 2. Okay, so this therapy with 2 to 3 atmospheric pressure is tolerated by the patient for about 5 hours. So this is given for total duration of 5 hours. Okay. Now, during this period, what happened? The dissolved form of oxygen increases in the arterial blood because of the oxygen carrying capacity is hemoglobin is limited. Okay. So that's why the dissolved form of oxygen increases in the arterial blood only, and at this level tissue oxygen tension also increases up to 200 mmHg, and tissue tolerated the high partial pressure of oxygen without much adverse effects, but oxygen toxicity develop when more oxygen is administered for long period of time. Okay, so this is all about hyperbaric oxygen therapy. Now next we have the condition that is known as asphyxia. So this is a condition by that is caused by lack of oxygen and excess of CO2 in blood that occurs due to obstruction of air passage. Okay, so this is a condition caused by lack of O2 and excess of CO2, right, in blood that occurs due to obstruction of air passage. Right. Now, if we talk about the various stages, so we have stage of hyperpnea, then stage of convulsion and stage of collapse. So one by one, we're going to discuss all these stages. But before deciding that, we should know that what are those condition in which this condition of asphyxia will occur. So various conditions are there like strangulation, hanging, drowning, various are there. And what will be the effect of this condition? So effect will be the stage of hyperpnea will be there, stage of convulsion will be there, and stage of collapse will be. Okay. So first we're going to discuss about the first stage, that is stage of hyperpnea. Okay, so this is the first stage of this condition and it extends for about 1 minute. Okay, now what happened in this stage, the breathing become very deep and rapid, and it is due to the power stimulation of respiratory centers by excess of CO2. And this condition is followed by dyspnea and cyanosis, and here the eyes become more prominent, right? Then next we have the stage of convulsion. Okay, So this is characterized by mainly uncontrolled involuntary muscular contraction. Okay, so whenever there is more and more muscular contraction will be there, so this condition will arise, and during this stage, the entire duration is less than 1 minute, and this condition of uncontrolled involuntary muscular contraction will lead to hypercapnia, and that acts on brain and produces the various effects like loss of consciousness, increase in heart rate, generalized convulsion. So many conditions will arise in this second stage of aphyxia. Then finally, we have the last stage, that is stage of collapse. Okay, so the entire duration is 3 minutes. Okay, and in this stage, severe hypoxia will produce the effects during this stage, like depression of brain will be there, development of respiratory gasping will occur, dilation of pupil will be occur, decrease in heart rate will be occur, loss of reflexes will occur. Okay, so various signs and symptoms will occur according to the stage. Okay, for example, in first stage there will be breathing problem, short of breathness. In second stage, increase in heart rate, loss of consciousness. Then in third stage, decrease in heart rate, depression will be there. Okay, loss of all reflexes will be there. So according to the each stage of apexia, various signs and symptoms will be there with the patient. Right, now next we have the Biot's breathing. So this is also known as cluster or ataxic breathing, and it is named for a French physician, that is Camille Biot, who characterized it in 1876. It is periodic in nature, and it is characterized by unpredictable irregularities in breathing that alternates the periods of apnea. Right. So this is basically another form of periodic breathing. Periodic breathing already we have done in the last class. What is periodic breathing? It is the abnormal or uneven respiratory rhythm. Okay, so this is characterized by the period of apnea and hyperpnea. Okay, and here waxing and waning of breathing do not occur. Here, after apneic period, hyperpnea will occur. Okay, now what are the causes of this Biot's breathing? So if we talk about the cause, so due to apnea, apnea means complete stoppage of breathing. Okay, so there will be CO2 accumulation will occur, and due to CO2 accumulation, it will stimulate the respiratory center and it will lead to hyperventilation. Okay, and during the process of hyperventilation, lot of carbon dioxide will get washed out, and the respiratory center are not stimulated, and apnea will occur. Okay, so this is all about the Biot's breathing. Now next we have the another condition, that is emphysema. So what is this condition? Basically, this is a kind of obstructive respiratory disease in which lung tissues are extensively damaged. Okay, and loss of this lung tissue will results in loss of alveolar walls, and because of this, the elastic recoil of lung is also lost. Okay, so here there will be loss of elastic recoil of lungs. And why this has loss? Because of damage of the respiratory uh, tissues, right? Yeah, or lung tissues. Okay, now what are the causes of the emphysema? So various causes are there. Few of them we're going to discuss. It is very common in the person who is a cigarette smoker or exposure to oxidant gases, then untreated bronchitis. Okay. Now, if we talk about the development of emphysema, so smoke or oxidant Gases irritate the bronchi and bronchioles and leads to chronic infection. Okay, and here it also increases the mucus secretion from the respiratory epithelial cells, which causes the obstruction of air passage. Okay, so this is all about the emphysema. Now, if we talk about the effects of emphysema, so what happens here in this condition? Airway resistance increases several times due to the bronchiolar obstruction, so the movement of air through the respiratory passage become very difficult and it is more pronounced during the process of expiration. Now, another thing we have is mountain sickness. Okay. Also, the mountain sickness is a very important topic. Usually, it is asked in the university exams. Okay. So, what is mountain sickness? Mountain sickness is a condition that is characterized by adverse effects of hypoxia at high altitude. Okay. So, this is adverse effect of hypoxia at high altitude. So whenever any person visited to high altitude, he or she may feel this kind of problem of mountain sickness. Okay. Now, it is also known as altitude sickness. Okay. So another name of this condition is altitude sickness, and it is more commonly developed in the person going to high altitude for the very first time. Okay. And it occurs within a day, and in the if a person is going for a first time and they become acclimatized to the altitude within few days. Okay. Now, what are the symptoms of this condition? Okay, so in mountain sickness, the symptoms occurs mostly in the digestive system, cardiovascular system, respiratory system, and nervous system. So one by one, we're going to discuss. If we talk about the digestive system, so there will be loss of appetite. There will be nausea and vomiting. Okay, and this occurs because of expansion of gases inside the GI tract. Then, if we talk about the cardiovascular system, so there will be increase in heart rate and force of contraction whenever the person visited to high altitude. Then, if we talk about the respiratory system, so here pulmonary blood pressure will get increased. Okay, and this get increased due to increase in blood flow, right? And blood flow increases because of the vasodilation that is induced by the condition hypoxia. Okay, fine. Then last we have the nervous system. So very common symptoms are there of related to nervous system, like headache, dizziness, depression, disorientation, irritation, lack of sleep, weakness, fatigue, many more symptoms are there. Okay. Now, if we talk about the treatment part, that what could be the treatment of this condition of mountain sickness? So the treatment depend upon the severity of sickness. Okay, and symptoms can be reverted by returning to lower altitude or by breathing exercise, right? So in this case, medical attention is required if the symptoms get more frequent. Now, another thing we have is artificial respiration. So what is this artificial respiration that actually we're going to discuss? So artificial respiration means applying some method to supply a person with air or essentially breathing for him. So there are natural methods for doing this, such as blowing air into a person's mouth when performing cardio pulmonary respiration, and that is known as CPR. And there are also hand operated or mechanical ways to provide these needed breaths if a person is not breathing on its own or is not breathing adequately. Okay, so about those procedure also we're going to learn. So this artificial respiration is required whenever there is an arrest of breathing. Okay, so arrest of breathing but without cardiac failure. Okay, so arrest of breathing occurs in many conditions, and that arrest of breathing can occurs in condition like accident, drowning. And in all those conditions, this artificial respiration will required. Gas poisoning, then electric shock. So many conditions are there in which artificial respiration will be required. So the stoppage of oxygen supply for 5 minutes will cause irreversible changes in the tissue of brain, particularly tissues of cerebral cortex. Okay. So artificial respiration must be started quickly without any delay before the development of cardiac failure. Okay. And the purpose of this artificial respiration is to ventilate the alveoli and again to stimulate the respiratory center so that the entire process of respiration can be begin again. Okay. Now, if we talk about the methods of artificial respiration, so as we have discussed, two methods are there. First is manual method and second is mechanical method. And both methods we're going to learn in today's class, right? So manual method can be applied quickly without waiting for the availability of any mechanical aids, and in which we do the mouth to mouth, right? So the subject will be kept supine, as we can see in the diagram also. The subject will be kept supine position, and the person who is giving the artificial respiration kneel at the side of the subjects, and by keeping the thumb or subject's mouth, the lower jaw is pulled downwards, and there will be a deep inspiration and there will be an exhale into the subject's mouth forcefully, and the volume of exhale air must be twice than the normal tidal volume. Okay, then this will lead to the expansion of the subject's lung, and then there will be respirator moves his mouth from the subjects, and now a passive expiration occurs in the subjects due to elastic recoil of the lungs. Okay, so this procedure is repeated for 12 to 14 times, and in this way the artificial respiration can be occurred mouth to mouth from by using the manual method. Okay, now another method we have is mechanical method. So mechanical method of artificial respiration become necessary when the subjects needs artificial respiration for long period of time. Okay, and it is essential during the respiratory failure due to paralysis of respiratory muscles or any other disorders could be the reason. So in this we do usually the Brinker method. Okay, now what is this Brinker method? Here there will be a use of machine. So the machine used in this method is known as iron lung chamber, or it is also known as tank respirator. Okay, so the equipment has an airtight chamber that is made up of steel, and subjects is placed inside the chamber with the head outside the chamber. So by means of some pumps, the pressure inside the chamber is made positive and negative alternatively, and during the negative pressure in the chamber, the subject's thoracic cage expand and the inspiration occurs, and during positive pressure, the expiration will occur. Okay, so by using this tank, that is a respirator, the person can survive for a long period of time, even up to the period of 1 year till the natural respiratory function are restored again. Okay, so this is all about the process of artificial respiration. Now, another condition we have is asthma. Okay, so we're going to learn about asthma. So basically, what is asthma? As we can see in the diagram also, normal lungs are there and asthmatic lungs are there. Muscles get tightened, and in the normal lungs, they get relaxed. Okay, so asthma is a condition in which the patient's airway get narrow and swells and start producing the extra mucus. Okay, so there will be secretion of extra mucus, and this can make breathing difficult and triggers coughing also. There will be production of whistling sound, and whenever the person will breathe out, there will be that will also lead to short of breath. Okay, now what are the symptoms of this disease? So various symptoms are there, like short of breath will be there, chest tightness will be there, then wheezing will be there, coughing will be there, trouble sleeping will be there, and many more symptoms are there that are associated with this condition of asthma. Okay, then For some people, asthma signs and symptom may also flare up to certain situation, like in exercise-induced asthma, which may be worse when the air is cold and dry. Another in occupational asthma, that is triggered by the workplace irritants, such as chemicals, any kind of fume or gases, right? So this is all about the asthma. And if we talk about the causes, that what are the main causes of this asthma? So causes are till now not clear, and some people get asthma and some other don't get. Like if maybe the some get the asthma due to any kind of irritant, but some other person will not get. Okay, so till now the causes are not as such clear, but it can be occurs due to airborne allergens like pollen, dust. Respiratory infection can be the another reason. Then cold air pollutants, smoke. So various reasons are there of having this condition, but still till now exact cause is not known. Okay, and what can be the risk factors? So number of risk factors are there, like having a blood relative with asthma. The person who are having the asthma can have the overweight, so high pressure will be there. And if the person is having is a frequent smoker, so the person can have this condition very easily. Then occupational triggers are there, which are working in a farming or manufacturing companies or any kind of industry can frequently have this condition. Okay, so this is all about asthma. Then another thing we have is pulmonary hypertension. Okay, so what is this pulmonary hypertension? It is a kind of high blood pressure. Okay, so high blood pressure that affects the arteries in the lungs and the right side of the heart. Okay, so in one form of pulmonary hypertension, that is also known as pulmonary arterial hypertension, blood vessels in the lungs are narrowed and they get blocked or they get destroyed. So the damage slows blood flow through the lungs, and the blood pressure in the lungs arteries goes up, and the heart must work harder to pump blood through the lungs, and extra efforts eventually causes the heart muscles to become weak and fall. Okay, so this is all about the condition that is known as pulmonary hypertension. Now, what could be the symptoms of this condition? So various symptoms are there, like short of breath, then chest pain, then dizziness, fatigue. The person may feel faint. Okay, so these are the common signs and symptoms. Now, what are the risk factors? Who are at risk of this pulmonary hypertension? So, the family history is the main common cause that have seen in the recent year. Then, if you are overweight, if you are a frequent smoker, then if you are the person is taking frequently drugs, or you are having a heart problem, or you are born with any kind of heart problem. Okay, then what can be this complication of the pulmonary hypertension? Means if the person is having this condition for a long period of time, so what could be the complication? So complication like right-sided heart enlargement can be there. It will also lead to heart failure. Blood clots are there. Irregular heartbeats are there. Then pregnancy complication can also be there. Okay, so various things are there that are also associated with hypertension, and that's why this disease is considered to be the very risky one. Okay, so this is all about the today's class. So I hope you find this class helpful. So thank you so much for watching, and also for any kind of doubt and queries, you can connect us with the various social media handles like YouTube, Instagram, Facebook, Telegram. So thank you so much for watching this class.